This brief slideshow will provide information on steps we must all follow to help prevent the spread of COVID-19 in our workplace. What is COVID-19? Novel coronavirus is a new virus strain spreading from person to person that has not been previously identified. Health experts are concerned because the new virus spreads easily and has the potential to cause severe illness and pneumonia in some people, especially people over age 60 or who have weakened immune systems. How does it spread? Through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people nearby or inhaled into the lungs. It can also be spread between people who are close in contact with one another, within about 6 feet. Our COVID-19 prevention plan has many aspects, including health protocols and screening, physical distancing, practicing good hygiene, cleaning and disinfecting, appropriate use of face coverings, and procedures for sick personnel. One of our health screening protocols is temperature screening each day. The required screening is done by the SeqScan system. The system does not store or record any identifiable data. The SeqScan system is a thermal imaging system that uses infrared technology to read the body's skin temperature. Our normal skin temperature range is 95.7 to 99.3 degrees Fahrenheit. Please see the screening procedure listed on this slide. Another piece of our health protocol and screening are attestations. Attestations must be completed by staff and visitors entering our buildings. Attestations must be completed each day. Employees and visitors must also sign into logs. These do not require time in or time out information. Information in these logs will be used if necessary for contact tracing. Please use legible handwriting when you sign in. Attestations are available through links on the Renton School District website, as well as through QR codes that are on the front door of each building. And remember, please stay home if you are sick. Please take a moment to watch this short video on temperature screening demonstration.
Returning to work this year is going to look different. Let us show you how. You will need to enter through designated temperature screening entries at your building. When you arrive for work, the first thing that you should do is apply hand sanitizer. Then proceed to the temperature screening kiosk and follow the posted instructions. If your temperature measures below 100.4 degrees and the screen turns green, please complete your daily wellness attestation and proceed to work. If your temperature measures higher than 100.4 degrees and the screen turns red, you will move to the secondary screening station and follow the instructions to retake your temperature. Remember, you should only handle the thermometer with clean or gloved hands. Supplies are provided at the station. Once you have read your temperature, please prepare the equipment for the next user by wiping it down with an alcohol prep pad provided at the station. If your second temperature reading is in a normal range, you should complete your wellness attestation and proceed to work. If any employee displays a temperature of over 100.4 degrees at the secondary screening station, they should return home and alert their supervisor immediately by phone or email. The supervisor will provide you with further instructions for how and when you can return to work. All visitors, including delivery drivers and contractors, must be screened for their temperature. At the kiosk, it may be necessary to remove hats or extra clothing. In some cases, it may even be necessary to crouch or stoop. Please do not adjust the equipment. Remember, it is essential to maintain social distancing during the temperature screening process. Markers will be placed at your feet to help with social distancing. Please notify your supervisor and stay home if you feel unwell. Your cooperation is appreciated, and thank you for helping to protect yourself and those around you.
It is important to maintain physical distancing whenever possible. Please try to stay 6 feet away from others. If you can, please work in shifts. Also, try to limit the number of people in each workplace. It is important to practice good hygiene, which includes proper hand washing. Please be sure to wash your hands often and for 20 seconds. It's also important to wash your hands before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing or sneezing, after handling your mask, and after caring for someone who is sick. Please use hand sanitizer, avoid touching your face, and cover coughs and sneezes. Stopping the spread of COVID-19 requires cleaning and disinfecting services. Our custodians sanitize and disinfect regularly. In schools, custodial staff use disinfectants and sanitizers regularly in high-risk areas. Those include nurses' offices, bathrooms, cafeterias, kitchens, drinking fountains, sink and door handles, and athletic facilities. Preferably, disinfecting and sanitizing is done when students are not present. Face coverings are extremely important and required in all of our buildings. All staff must wear a cloth face covering in shared spaces. This includes hallways, bathrooms, and any workspace that is not an individual office with a door. This slide shows the appropriate do's and don'ts of face coverings during COVID-19. Please take a moment to review this slide. It is important that you understand the symptoms of COVID-19. Please take a moment to review this slide. Symptoms of COVID-19 can include the following: cough, shortness of breath or difficulty breathing, fever or chills, muscle or body aches, vomiting or diarrhea, loss of taste or smell. Symptoms can range from mild to severe and appear from 2 to 14 days after you have been exposed to the virus. Please do not come to work if you are sick. Notify your supervisor if you are sick and unable to come to work. Call your healthcare provider if you have symptoms of COVID-19 to determine testing needs. We can all keep each other safe at work by doing the following. Check our temperatures upon entering the building. Attest before entering any district facility. Remember, staff and visitors are required to complete the health attestation daily. Wear your face mask. It should cover your mouth and nose when you are in any open space. Stay 6 feet apart from others and wash your hands often.